in the United States. Dr. John Lott is with us, and he's an economist, a columnist, the author. His latest book, Freedomnomics: Why Free Markets Work and Other Half-Baked Theories Don't. His website, johnrlott.blogspot.com. And busting right-wing, left-wing healthcare myths. Healthcare myths! John Lott, welcome to the show.
Oh, nice to talk to you again.
Yeah, thanks for coming back on with us. You're blogging and sending out news releases and stating that basically we don't need to worry about, what's going on with healthcare because we've got just a fine system right now. Even the nonprofits are doing just a fine system. Am I missing something?
No, I don't think I'm quite saying that. What I was trying to argue in the piece last week for Fox News was that there's a lot of misstated numbers that are out there, and one can make a case. Well, for example, how concentrated the healthcare industry is. During the president's address to Congress, he was claiming, for example, that almost 90% of the market in Alabama was controlled by the insurance market in Alabama was controlled by one company, or that if you look at the 34,
it's actually 86% in Alabama for Blue Cross Blue Shield, is it not?
Well, it's actually much lower than that, and it's actually about 36% if you include all insurance that people have.
That's if you include Medicare and Medicaid, but we're talking about
no. If you include just private insurance, if you include the fact that about over 50% of the people that have private insurance in Alabama have it through what are called self-insured companies. So a lot of
That's not insurance, though.
It is insurance. When you go, you get a little card. You go to the hospital or the doctor. It acts just like a regular insurance operation that's
But
there.
the self-insured companies are every bit as toxic as the for-profit companies, in many cases even more so, because many of the very large corporations in America, and this is the dirty little secret that most people don't realize, is that while they think that, WellPoint or Aetna or Blue Cross or something is handling their health care, actually they're not, because these big corporations have already figured out the scam that's being played on most of us, and rather than paying the 25 or 30% for the $110 million a year compensation package that Stephen Hemsley is taking as head of United Healthcare, they have one of these companies just do the administration for a basic fee, which is profitable for the health insurance companies. But if there's a profit to be made, they keep the profit themselves.
No, but there are two issues here. One is, what's the right number? What's the number that the president's using? And the other one is, do you want to have all these companies do this self-insurance? But the president's simply wrong, and it's scaring people unnecessarily. The question is, why does he have to use a number like 90% when it's not even close? You have tens of thousands of
80%,
companies
86%
out there.
is the official number.
No, it's 86% of about 40%. Because about 40% of the people in Alabama
That's because you want to include the self-insured companies rather than those who are using the insurance companies.
No, but that is still insurance.
No, but it's not.
Insurance.
None of it is insurance. Everybody's playing the same scam game, whether it's a big transnational corporation or a big statewide corporation or, any corporation large enough to have enough people to spread risk. They're all figuring out ways to scam money. Even Blue Cross Blue Shield. Cleve Killingsworth, the head of Blue Cross Blue Shield down in Alabama, was it Alabama or Louisiana we were talking about? I'm mixing up. Alabama. Down in Alabama. His pay went up 26% last year to $3.5 million. This is a nonprofit corporation. It's the whole argument that you're making that we don't have anything to worry about because you already have nonprofits, so playing big roles in the game. I would say is specious because the nonprofits are behaving as if they were for-profit companies.
Look, the president claims that there's certain advantages for having a nonprofit there, that you don't have the same costs that a for-profit has.
No, he's arguing that a government agency, not a nonprofit.
No, but he's specific. You go through his speeches. Speech after speech talks about the advantage of being a nonprofit, because he says that for-profits, you have to add this profit on to the other costs, and that gives them a disadvantage.
Right, the distribution of profits to shareholders.
Right. So he talks
You're disputing
about that a lot. First of all, the point is that in the vast majority of states of the United States, the largest insurance companies in a state are nonprofit. I mean, that's just something that would be useful to go and bring out there if he's going and arguing that there's such big benefits.
And my point is that the nonprofit health insurance companies in this country are playing the same game the for-profit ones are. They're not doing it in quite as toxic a fashion, but when you're paying your CEOs millions of dollars, when you're paying your senior executives huge amounts of money, when they are creating fund balances. You know, speaking as somebody who started a nonprofit back in '78, and I'm still on the board of directors here 30 years later, I can tell you, it is possible. We've never done it with our nonprofit, but it sure would be a good idea. Harvard's sitting on a multi-$100 million endowment. I don't know, maybe it's even $1 billion these days. It's entirely possible for a nonprofit to show a massive surplus. And many of these health insurance companies, these nonprofit health insurance companies, are doing that. And then over the years, they use that surplus to compensate their executives.
Let me ask you a question. From people listening to the president's speeches, how many of them would realize that the largest insurance company in most states is a nonprofit? I don't think anybody would know that from listening to the type of discussions the president.
Well, my
had.
point is that the distinction is blurred to the point of meaninglessness. That what we need is a government option. That we need to be able to buy into Medicare, basically.
Well, first of all, the president's arguments time after time have been about the virtues of nonprofit. It hasn't been about the virtues of government. In fact, many times the president has denied that what he's proposing is a government system.
No, I understand that. And in fact, when I just said I think that everybody should be allowed to buy into Medicare, the president is not saying that.
Right.
And so neither are the conservative Democrats. Max Baucus would fall over in a faint if you said that within 100 feet of him and he could hear it.
Right.
Because he would lose $3 million in campaign contributions from this corrupt, sick, twisted health insurance industry.
Now, I'm happy to go and defend parts of the system you're attacking, but the main point of my piece was to say where people are using incorrect facts, a lot of incorrect facts, and I think there's a reason why they're being used, because I think they're scaring people or trying to scare people into making decisions that they wouldn't otherwise make if they had actually been given the correct information. Now,
so what's the decision people would make? We're paying twice as much as any other country in the world. I mean, even true. Mexico insures all of its citizens, and it does it for $250 per person per year.
First of all, we don't pay twice as much. That's another thing. My piece this week for Fox goes into that. There's a lot of double counting in the numbers that the president uses. For example, what it counts is not only the payments that insurers or patients or the government makes to healthcare providers, but then it also counts the expenditures that healthcare providers make on buying MRIs, buying buildings. You don't do that for anything else. I mean, it would be just the same as going and saying we're going to count the size of the farm sector is going to be the amount that customers.
Well, let's just boil it down to something really simple, John. We're talking with Dr. John Lott. His website, johnrlott.blogspot.com. Just really, really simple. We've had a number of Canadians on the show, from Canadian politicians to we have a lot of Canadian listeners and Canadian citizens. We have French listeners. They call into the show. We have people call into the show from Sweden, from all over the world. We've had a lot of callers. And I have yet to hear from any of these people that they're paying more than, our typical Canadian callers are saying that they're paying between $100 and $140 per month for an entire family. We had one that was paying $180 for the whole family.
But that's not the taxes that they pay. They're just telling you, look, there's a question.
No, this is the payment that they're making into the Medicare system.
No, but that's their out-of-pocket payments.
No, this is not the out-of-pocket. This is the monthly check that they write to enroll in the state Medicare, in the province's Medicare system.
But that doesn't count the tax dollars that they're paying from their income.
Well, right now we're not counting the tax dollars that we're paying for all the people who are showing up in ERs because they're uninsured and their kid has strep throat.
Look, in those countries, the tax dollars make up a much bigger share of the total payments going to the medical system than it does in the United States.
Then why is the healthcare system 15 or 16% of our GDP, and it's only 10, 11% of Canada's, and it's only 7 or 8% of France's, which, according to the numerous studies, and most recently by the United Nations, has the most competent, the best outcome healthcare system in the world.
Well, okay. Well, there are two things here. First of all, just on the level of expenditures, it's that double counting that I was talking about before. Ours, if you don't do that, is about 13%. But the WHO actually counts it against us that we spend money on health care. They say that's bad. That's a negative outcome.
Okay. People can read all about it over at John R. Lott, L-O-T-T, .blogspot.com. John, I'm sorry I missed the cue there to let you know. Thanks so much for being with us.
Take care.
Bye now.
This is the Thom Hartmann Program.